Did you know that nearly half of all adults worldwide may be living with a condition that has no warning signs, yet can lead to heart attack, stroke, or even kidney failure? It's called high blood pressure, the silent killer. While prescription medicines remain the gold standard, research shows that nature also provides powerful tools with fewer side effects. In this video, we'll reveal 7 science-backed natural ways to control high blood pressure safely and effectively. First, the power of hibiscus, Mother Nature's ACE inhibitor. Hibiscus tea, also known as roselle or sour tea, is one of the most studied herbs for lowering blood pressure. Clinical trials and meta-analyses show that hibiscus can lower systolic pressure by around 7 to 10 points and diastolic by about 2 to 5 points within just 6 to 12 weeks. How does it work? Hibiscus blocks the enzyme ACE, improves blood vessel flexibility, and acts as a gentle diuretic. Drinking just 1 to 2 cups daily can provide noticeable benefits. Second, garlic, the old cure with new science. Garlic isn't just for flavor, it's medicine. Aged garlic extract has been shown in multiple clinical trials to reduce blood pressure by an average of 8 points systolic and 5 points diastolic. The secret compound, S-allylcysteine, boosts nitric oxide and hydrogen sulfide in the blood, both relax blood vessels and improve elasticity. Even better, garlic supplementation has been linked to slowing arterial aging by up to 5 years. Taking 600 to 1,200 milligrams of aged garlic extract daily for 8 to 12 weeks is considered both safe and effective. Third, omega-3 fatty acids, marine treatment for high blood pressure. Omega-3 fatty acids, especially EPA and DHA from fish oil, consistently lower blood pressure in clinical studies. Meta-analyses show reductions of 2 to 4 points in systolic and about 1 to 3 points in diastolic pressure. They relax blood vessels by opening potassium channels, reduce inflammation, and improve endothelial function. For best results, most studies recommend 2 to 3 grams of combined EPA and DHA daily for 8 to 16 weeks. Fourth, beetroot juice, the nitrate powerhouse. Beetroot juice is one of the fastest natural blood pressure remedies. Thanks to its high nitrate content, the body converts it into nitric oxide, which relaxes arteries. Studies show reductions of 4 to 8 points, systolic and 2 to 5 points, diastolic, sometimes within hours of drinking it. For maximum benefit, 250 to 500 milliliters of beetroot juice daily, equivalent to about 400 milligrams of nitrates, is recommended. Fifth, Hawthorn, the cardiovascular tonic. Hawthorn has been used for centuries for heart problems, and modern science supports its use. Standardized extracts can lower systolic blood pressure by 3 to 13 points and diastolic by 2 to 8 points in some trials. Its bioactive flavonoids and procyanidins improve blood vessel dilation and circulation. A dose of 300 to 900 milligrams daily for at least 6 weeks is most effective. Sixth, green tea, the antioxidant solution. Green tea is more than a refreshing drink, it's a cardiovascular ally. Thanks to its catechins, especially EGCG, green tea modestly lowers blood pressure by 2 to 3 points systolic and 1 to 2 points diastolic. It works by boosting nitric oxide, reducing oxidative stress, and improving endothelial function. Drinking 3 to 4 cups daily, or taking a standardized extract, provides the best benefits. Seventh, magnesium, the relaxation mineral. Magnesium isn't a herb, but it plays a vital role in vascular health. Meta-analyses show consistent reductions of 3 to 4 points, systolic and 2 to 3 points, diastolic. Magnesium acts as a natural calcium channel blocker, relaxing blood vessels and lowering resistance. Supplementing 200 to 400 milligrams per day for 8 to 12 weeks is safe and effective, especially in people with low dietary intake. Clinical benefits and safety notes. All these natural approaches offer impressive benefits, ranging from 2 to 13 points of blood pressure reduction. Even modest reductions translate into a 16 to 40% decrease in risk of heart attacks and strokes. But remember, consistency matters. Benefits often take 6 to 12 weeks. Standardized, high-quality extracts ensure reliable results. And most importantly, always consult your doctor before making changes to your treatment plan, especially if you're on medications. To recap, hypertension may be the silent killer, but nature has given us powerful allies. Hibiscus and garlic are among the strongest natural remedies, while omega-3s, beetroot juice, hawthorn, green tea, and magnesium provide additional cardiovascular protection. Together, they can be safely incorporated into a comprehensive lifestyle and medical plan for blood pressure management. Thanks for watching. If you found this video helpful, don't forget to hit like, subscribe to Phytotherapy Hub, and share this with someone who cares about heart health. Stay healthy, naturally.